Good afternoon. We are now going to call the Curriculum Instruction and Assessment Committee to order and have roll call. Joanne Adams.
This is Joanne Adams, and I am present.
Claire Batt.
This is Claire Batt. I'm here.
Patrice McCrary.
I am present.
Randy Poe. Randy had to leave. Jamie Bowling.
Jamie Bowling, and I'm present.
Allison Sloan.
Allison Sloan, and I'm present.
And Soliana Mesfin.
She had to leave.
Yes. All right. And welcome to you, Dr. So we have one item in this committee to review today. It's a review item, and it's the Whole Child, a Framework for Success. Are you going to be presenting today?
My name is Robin Kinney. It's nice to see you all again. I was just going to introduce Mr. Jim Tackett. So Jim works in my office. He is the director of our Coordinated School Health Project. And I wanted to brag on him a little bit because I know he won't do it himself. So if you'll allow me just for a minute to talk about Jim and his team. They are a very small team of 3 people. And while the coronavirus pandemic has really consumed all our lives for the last 14, 15 months, we thought it is important to share with you the good work that Jim and his team have been doing since long before the pandemic hit. For about 20 years, Kentucky has been working with the Centers for Disease Control and Prevention, and Jim and his small team work really in a cross-agency, cross-cabinet collaborative, and they focus really on the whole child. So Jim's going to go through the presentation, and they do a wonderful job. I just wanted to be able to kick him off and brag on him and his team a little bit, and then I'm going to excuse myself and go to the other committee meeting for other agenda items. So Jim, are you online and can join us now?
I am.
There he is. Okay, Jim, I'm going to turn it over to your capable hands.
Thank you, Robin. Good afternoon, everyone. Can you hear me?
Yes.
Okay, wonderful. Well, we thank you for the opportunity for us to spend a little bit of time this afternoon to talk a little bit about the whole community, whole school, whole community, whole child model. And sometimes we shorten that into WISC for easier saying. But I would like to share briefly a short presentation. And then when we get finished, open it up for comments or questions that you all may have. So I am joined by Stephanie Bungie, one of our team members. So she's going to navigate our slides as we move forward. So once we get loaded, we are ready to roll, Stephanie. So you can move to the next slide. So we wanted to spend a little bit of time this afternoon talking about and framing the context of student achievement and health outcomes, which is basically our work each and every day in our team. While this will only scratch the surface of our work, I hope that it will pique interest, pose questions, and generate some discussion around how students' academics and health outcomes and behaviors impact one another. So as Robin mentioned, our work is about the whole child and how we can impact in a positive manner the whole child. Next slide, please. So on this slide, you actually see our small team. We have 3 individuals, staff members that reside at KBE, myself, Stephanie, and then Julie Martin, who has worked extensively this past year with our educational co-ops, and we'll talk a little more about that as we move on. But we also have a staff person at the Kentucky Department for Public Health, Nicole Barber Kolbe, and as Robin mentioned, the interagency respect of this work is not only crucial but required from CDC, who is our funding source. But we'll talk a little more about that as well. Next slide. So I wanted to give you a context of where where our team and what our team works on, Kentucky currently receives funding through a 5-year cooperative agreement with the Centers for Disease Control and Prevention. You see that current cooperative agreement began in 2018 and will take us through 2023. We're one of 16 states that were competitively awarded funding and receive ongoing support from CDC. The grant originally asked us to identify 9 priority districts, and those districts that we identified are Bath, Casey, Garrett, Johnson, Lee, Lee, Lewis, Morgan, Pulaski, and Rowan counties. And each of those counties received targeted professional development, technical assistance, and extra resources to help them develop infrastructure, programming, and policies supportive of the WISC framework. The remaining Kentucky school districts can receive similar assistance to travel this journey if they so wish from our Healthy Schools team. While the current funding only addresses a smaller portion of the WISC framework, we strategically work to weave all that together when possible. Next slide, please. Health and well-being have for too long been put in silos, both logistically and philosophically, apart from education and learning. Charles Bach, in his meta-analysis, Healthier Students Are Better Learners, called for a renewed focus on health as the missing link in school reforms to close the academic gap. So as you see in his quote, and I will not read it, it has major impact, and I think it causes us each and every day to reflect on how we are supporting or how we're impeding the progress of our students related to academic achievement and health status. Next slide, please. And he continued in the same publication saying, through rhetorical support, though rhetorical support is increasing, school health is currently not a central part of the fundamental mission of schools in America, nor has it been well integrated into the broader national strategy to reduce gaps in educational opportunity and outcomes. Next slide. Just as every child in the Commonwealth is unique to his or her learning styles, preferences, motivation, and ability, they too are different in the experiences that they carry with them. This picture helps symbolize who they are and what has and continues to shape them as individuals and as students. Homelessness, family structure, illness, hunger, support structures, substance use and abuse are just a sampling of the items that are in their backpacks as they enter and leave our schools each and every day. Unfortunately, these challenges are not easily removed, as you all well know.
Looks like he's frozen.
That's a significant pause.
Jim, I don't know if you can hear me, but you're
Sorry,
frozen.
folks.
Okay. Now you're.
I'm back. Sorry. But as I was saying, unfortunately, these challenges are not easily removed. As educators and caring adults, we must ensure that we have positive relationships and the supports for our young people to help them be more resilient and rise to their fullest potential. These backpacks have further been weighed down, as you all know, in the past year plus due to COVID. So the question becomes, how can we lighten these backpacks and strengthen their straps as they continue to move forward? Next slide, please. Has your slide advanced?
Yes.
Okay, well, I will.
It looks like you're frozen again.
I might ask him to go to the ellipses and turn off his incoming video.
Jim, maybe go to your ellipses and turn off your incoming video.
Sorry, folks. I'm going to turn my camera off for a second and see if that helps.
That's okay. That'll help. The incoming video helps even more.
If you can see where it says incoming video, that might even help more.
Okay. Let's see if we can move forward now.
Okay.
So in this slide, research and data has documented grades and health behaviors among our students. This slide actually from CDC notes that it's unsurprising student academic performance and health behaviors frequently follow a predictable pattern. And as a result of that, we probably are not surprised that students who are engaged in riskier health behaviors typically will demonstrate poor performance academically too. So you look at illegal drug use, also sexual partners, safety in their missing of school and truancy, as well as the social, emotional aspects of feeling hopeless in regards to their environment in which they are. Next slide, please. In your packet that you were provided, we included our most recent youth risk behavior survey that was put together in an infographic from the Division of Communications. And when you have a chance, I would encourage you to take a look at that. I've just highlighted 4 of the bullets from our 2019 student report. We actually received funding from CDC in regards to collecting this data every other year for our middle school and high school students, but it demonstrates what behaviors our students are currently engaged in. And again, helps with programming, grant writing, etc. as we look across the state. While we can't demonstrate, or we can't look at individual districts that are randomly selected in schools, this is an aggregate state report that again is very eye-opening. And I think when we begin collecting in the fall, it will be interesting to see how this data and trend data has looked, especially after the pandemic. Next slide, please. So as we talked about academics and health outcomes dovetailing and reflecting one another, I just wanted to include this slide and ask that you take a look at many of the measures that we use to determine education impacts really have a health flavor in them and an indicator as well. So when we look at our current accountability system, we see dropout, we see readiness, we see attendance and student performance, but how each of those impact behaviors that our students are engaged in, their social determinants of health, even the knowledge that our students carry with them and glean from school and their experiential situations. So a huge opportunity for each to reflect one another as we continue our conversations about equity at the department. There's a huge equity conversation occurring in the health arena as well, and how those can support one another too. Next slide. I would further, if you go back to our previous slide, looking at our backpack scenario, I would ask that you envision these items being in the student's backpack. What are they coming to school with? What issues, challenges are they bringing with them as they sit or as they actually sit in front of their computers more recently to address and try to academically perform, but yet these are looming over their head in regards to health-related situations. So again, we can't separate health and education if we truly are thinking about the whole child. Next slide. I want to spend a couple minutes and show you a very brief video in which describes the whole school, whole community, whole child model. And I think it will put into context what we're talking about and how both public health and education can work together. So we're going to keep our fingers crossed and hope that you all can hear the video as it starts. So while school health has been a while around for quite a while. Next slide, please, Steph. Kentucky has had a formalized partnership in the form of various cooperative agreements to enhance student success for over 25 years. Staff and partners have provided numerous professional development opportunities, institutes, workshops, conferences, technical assistance, and individual support. Research repeatedly demonstrates a dedicated infrastructure must be developed and maintained for school, district, state level efforts to be effective. The KBE WIS subcommittee strives to model what on local communities and school districts should emulate to further recap.
Jim,
Yes.
we're still getting a, I don't know if your assistant, your slides, box, that, share the video, audio box, that's, echo.
Let's see. Nope.
Stop sharing. Started. Slide. It should be okay.
Sharing and go back to the slideshow. It should be okay.
Okay, I stopped sharing. You want me to try again?
Yes, please.
Okay.
You're not echoing.
Oh, well, that's good. Okay.
All right, Jim.
All right.
I think we'll be able to get you now.
Super. So one of the requirements that we have as a funded state is to have a statewide framework, and that is our Kentucky Board of Education WIS subcommittee. And I have to pause just for a second and recognize Mary Ann Miller for the work that she did many years ago in this and really being a champion around school health. This was a model that Kentucky has really set forth even back around 2010. And many states have moved along the same line. But even for a period of time when public health was the folks that received funding across the country, Kentucky continued that model and continued to champion the importance of school health in their education department. So Mary Ann's commitment and concern for kids across our Commonwealth continues to not only impact Kentucky, but across the country. So our work would not be possible without that recognition from her. So I wanted to make sure to say that. But as Robin mentioned in her introduction, this work is more than just folks within the Department of Education. It looks at folks at public health, folks and behavioral health. It looks at several other partners, including Family Resource Youth Service Centers, the Pritchard Committee, the Foundation for a Healthy Kentucky, and the list could go on and on. But it's really about how we go about doing our daily work, and not about a project, but looking at how we can be data driven, how we can have continued partnerships, collaboration, and discussion around key issues that are occurring within our state, as well as implementing best practices and research-based strategies too. So this work continues to occur. There are two KBE members that are on our subcommittee that typically meets the day before the board meeting. And those are Cody Polly Johnson and Lieutenant Governor Coleman. So they join us for those conversations and for the work that is occurring in this area. Next slide, please, Stephanie, as we wind down. So again, this model probably looks familiar. We just saw the video, but it's really about where we can put this into practice. This is a huge framework, and it cannot be, obviously it can't be tackled and put in place all at once. But oftentimes school districts will ask us, so where do we start? And we tell them, you start where you are. Look at what you already have in place, whether that be infrastructure with committees and folks, whether that be with programs and policies. What do you have that's going well? What do you think needs to be improved around student health, around student outcomes and academic achievement? But it's a matter of continuous improvement, realizing that we all experience success, but we all have opportunity to make those areas better as well. Next slide. We just saw the video that was put together by ASCD and the Centers for Disease Control, but I would like to end on this and a final quote. We challenge communities to redefine learning to focus on the whole person. We encourage schools and communities to put aside perennial battles for resources and instead align those resources in support of the whole child. Policy, practice, and resources must be aligned to support not only academic learning for each child, but also the experiences that encourage development of a whole child, one who is knowledgeable, healthy, motivated, and engaged. Next slide, Stephanie. And I wanted to close out with Dr. Lloyd Kolbe, who spent many years at CDC and was one of the fathers around the whole school health initiative many years ago. And I think it sums up what we're talking about. If American schools do not coordinate and modernize their school health programs as a critical part of educational reform, our children will continue to benefit at the margins from a wide disarray of otherwise unrelated, if not underdeveloped efforts to improve independent education, health, and social outcomes. And if we forfeit one of the most appropriate and powerful means available to improve student performance. So I'm going to stop there and ask if you have questions, comments, thoughts, but we would be happy to answer those if you have them.
Yes, Patrice.
And Jim, Patrice McCrary, just curious, do you and your team have the legislators? Because there's certain legislation that needs to be in place to fully support some of this the way it should be.
I'm sorry, I only heard a part of that related to legislation.
Sorry, I don't know if my microphone's working.
I think you just have to get closer.
Yeah.
It's a little better, I think, now.
I'm eating the mic right now. Do you and your team have the opportunity to interact with the legislators on building the proper legislation to support what you're trying to do across the Commonwealth?
We have had limited opportunity, and I will tell you that since we are currently grant funded, that doesn't necessarily always align. And I'll give you one example of that. You know, several years ago, looking around local wellness policies that our schools and districts must follow if they're if they participate in the national feeding program, breakfast and lunch programs, then they're required to develop local wellness policies. We also have state legislation several years ago that required pieces of that. Some of them are a little confusing. Some of that is only required if you participate in those national programs, yet the other piece of that includes physical activity, requiring schools to assess their physical activity and nutrition environments annually as well. We are required to report to the LRC each year on that state report. So sometimes it's a matter of looking at if we need to realign and if there are confusing pieces that both federal and state do not align with. But in a very short answer, we haven't had a lot of opportunity to directly work with the legislature in regards to even education and sharing some of the information that we included in your packets.
There's a follow-up
Quick
question.
follow-up question about that. What is the lifetime of this grant?
We are currently in year 3 of a 5-year cooperative agreement. If it's like everything else, we anticipate being able to competitively apply for another 5 years, as has occurred in the past, but we don't have any guarantee of that.
My question, this is Claire Bannon, my question is sort of a follow-up with what Patrice was asking. I know I've sat through many committee hearings in the Senate and House where the mental health aspects of school safety have been a concern. In fact, we have had legislation that mandated SROs and increased numbers of counselors be put into schools. I'd like to hear you talk a little bit about what the mental health aspects are in terms of your work, and how can the work of the mental health practitioners such as clinical social workers and psychologists be part of your work, and what steps we as a board might take to support that, and also what is in place at KBE to support that work. I know I've talked to some of my friends who work in mental health, and one of the concerns they've expressed is that they feel as if there's not enough representation to actually perform triage of mental health concerns that come up in schools or in when we talk about legislation or even policy. So I know that was a lot, but we can work through it.
I'll try to tackle and may ask you which pieces I left out. Well, part of the WISC subcommittee purposely not only asked schools and districts to develop infrastructure, but we're required at the state level to develop infrastructure too. And our infrastructure begins with the WISC subcommittee. We have a variety of folks who sit on that, and I would include our project aware folks at the department. Again, folks across agencies too, not just us, but other individuals at behavioral health included. We are continuing to look at professional development and training in regards to how can we tag team to support our schools and districts, what is currently available, where do we need to look elsewhere on. It's interesting you mentioned the SEL piece. We are currently not funded in our cooperative agreement to address SEL as a really a component. The areas in which are funded right now are physical activity and physical education, management of chronic conditions, so those students that have asthma, diabetes, obese, those individuals. Out of school time, so programs not only during the summer, but also before and after school. So those are our, and nutrition are the 4 areas that we're funded currently. However, with the onset of the pandemic, CDC allowed us and passed some additional funds to each of the currently funded states to assist with transitioning our schools and districts back into session. One of those items that they recognized and that we can use some of those funds do address SEL and those needs. So in the past year, we've worked very collaboratively with our educational co-ops across the state to enable them to provide some research-based strategies with their schools and districts around SEL and what not only students were needing, but also some of the needs that were emerging as staff too. So it is only a tip of the iceberg in which we've been able to directly impact. However, through our partners in our interagency or our WIS subcommittee, we've been able to place that on the radar. We were just notified that we will get an additional round of funding for the next school year that will continue to help our students move forward in that area. I think the collaboration with each of the co-ops being able to increase staff through the CRISA funds will be very important, especially each of those co-ops being able to receive a SEL specialist. So we anticipate being able to work even closer with those co-ops in moving forward to address some of the issues that you mentioned. The direct services are not allowed from our funding, but again, in partnership with those folks who are have those resources, we are definitely interested in continuing those conversations and collaborations. I hope I answered some of your questions. I don't know.
I think you covered some. In looking at direct services, I know that sometimes, the qualifications that a practitioner has would allow to bill Medicaid or not bill Medicaid. So in looking at the structures you put in place, are you making recommendations about trying to get more personnel in schools who would be able to handle some of those more severe emotional needs that kids are having? Just listening to some of the research that's come out about the priorities expressed by students in terms of their own mental health, it seems as if that should be a primary concern.
We are trying to, we're working, as you all may know, the federally qualified health centers that are across the state. We have partnered with them over the last year to begin to provide some resources and supports for students and families. I will tell you it's a start, but it's not near where we need to be. And I'm hopeful, because mental health as a whole has really been left unaddressed for quite some time. And as the pandemic emerged, we saw a even quicker eroding of mental health, if you will, from not only our students, but our staff and our families too. So it's something that we're continuing to talk about, looking for resources and figuring out ways to collaborate, but we don't really have a true solution at this point.
Thank you. So, any other questions? So certainly this past year has really heightened our awareness of considering the whole child in their education, and we are very grateful for your presentation today and glad that there is a system in place to help with some of these improvements. So next we need a motion to adjourn.
I so move.
Thank you.
I'll second.
Thank you very much. So motion by Patrice, second by Jamie. All in favor of adjourning this committee? Aye. Any opposed? All right, thank you. So we will convene back with Chair Young.